0467 922 666 if you'd like to argue away or support or provide constructive criticism. I welcome it today because you've had a lot to say about that this morning on Mornings. We're not done yet, by the way. Before 11 o'clock, the latest from the Desi and community in ACT, Vikas Sharma, our regular touch point voice in the region, is going to be with us soon. And the National Film and Sound Archive, its fabulous collection, well, I would say, of priceless audio video, will be focusing on regional TV in this country, including in this region as well.
This is Mornings with Adam Shirley on ABC Radio Canberra.
Yeah, maybe you are recovering from COVID, or you've got another health issue that's pressing. Perhaps being back on school, if you're a parent or volunteer, is the issue. We mentioned that a little earlier, and you had quite a few questions and comments to add after 8:30. Vikas Sharma is a community broadcaster and our community correspondent to many parts of this region, and every fortnight or so we catch up with him. Vikas, good morning to you. How you been the last month or so?
Good day, Adam. The question, the same goes for you. I'm fine. How are you?
Look, getting there. As I've mentioned a few times, I'm more than halfway through my ISO period. Having got the coronavirus bug, and I feel like I'm quite fortunate at this point, bouncing back a little quicker than I know it is for some. And I'm not being complacent because it can go a few different twists and turns. Just on that, Medicare, the health system seem to be and always are a focus of a political campaign. But what have you been hearing from people who might be trying to bulk bill, getting some hospital services or other healthcare services they need, Vikas?
Well, I think as you know, Medicare and everything related to health is generally related to everyone, not only the community, but everyone in ACT and Australia as well. But what I've been hearing is that most of the time people are confused. It's a bit of complex system to veer through and, to get those services when they're actually wanted. People sometimes, don't get the kind of attention that they have to get. So for example, if visiting a GP or a health service is not like, visiting an amusement park or for a fun, there will be times when you are pressed on whether you should be going in. So, for example, if you are feeling symptoms of flu, you wouldn't know whether it is flu or is coronavirus or is it something else. And similarly goes for other things. I've just read an article over the last week in one of the magazines in which one of the person who covered was said that she actually had some problems in her chest, and she was thinking, is it something which is normal or is it something more than that? And she visited GP, and then specialist was required, but then the kind of treatment took its time, and ultimately after 1.5 years she found that it was breast cancer. So what I'm trying to arrive at is that it's a lot of complex system in terms of even bulk billing, people paying out of pocket expenses. They get a little unsure of what kind of bill they will be stuck with at the end of the treatment.
Yeah, just on that then, Vikas, how much do you know and how much do people tell you that access to a list on a local GP is the problem? The cost maybe of getting treatments, mental health support or waiting in a metaphorical line for that. How challenging are people finding it?
It is because, for example, as I said, if I'm feeling unwell and I call up and I say that I need an appointment with a GP, most of the times it wouldn't be at that point in time. It will be like in 2 days, 3 days, 5 days, or maybe 2 weeks later. I mean, by the time I might be recovered or might take a Panadol or whatever means that I have to recover myself, because I can't be in that state. So it's definitely an issue in the sense of finding the as I said, the right person at the right time to get you through that illness, or maybe suggest something which is required. So it's definitely a pain.
Vikas Sharma is at ACT Desi, a radio community broadcaster, and is our voice on the ground in and around the region for a number of parts of the community. Adam Shirley with you on ABC Radio Canberra Mornings. Is it about the money in the end? We know of the relatively low bulk billing rates in the ACT Vikas, but is it the funds that people have once they've paid rent or mortgage fees, school fees, and the lack of money they might have for that healthcare spending?
That's definitely the case, right? We're living in an economy where everything is related to capital or money. So, after inflation rate is going high, with that, the mortgages are going up, the rental is going up, the groceries are going up. So imagine if people have to, people can't stop eating, people can't stop sending kids to the school, people can't, stop mortgage payments. What they can definitely do is try to prolong, as I said, I'm not feeling well, but I can say, okay, let me try my own resources because I'm not finding the right kind of medical advice. And then if I do find it, I have the back of my mind that, what kind of bill I will be stuck out of pocket payment, as you said. It's definitely one of the important things, gap payments. People are clueless about it. The bills that come, I've been told a couple of people that bills that comes and the list items, they wouldn't know. Sometimes what happens is and it's been encouraged that people ask their specialist or before they get into the service. But imagine if person is seriously ill and they have to get the surgery done. Would they have so much time to find out what kind of expenses they'll be expecting? Can they actually? This is one of the things I also read is people don't really ask the person or the GP or a specialist that what kind of money would be spent or the cost of this treatment, because they fear that if they say that I can't spend that kind of money, the level of quality of healthcare would be jeopardized. So they don't ask, and then what happens is at the end of the day, when they get through that treatment, and then the bill comes, they're stuck. There are a lot of things which are gap payments. Private health insurance won't cover. You're still paying taxes. There's a lot of things, and that's what I said in the beginning. It's a complex system. People are unaware, and that with the unawareness, and with sometimes a lot of things to read about on your own, instead of having the medical state that you are already in. It's a challenging thing to do.
Yeah, I'm guessing some local candidates, if they have concrete things to say about these issues and the healthcare issues some people are facing, that might attract some positive attention. Vikas Sharma, we'll leave it there for today, but as always, indebted for your input and your knowledge. Thank you.
Thank you so much, Adam. Take care.
Vikas Sharma at ACT Desi, a community broadcaster as well, and nice to have your responses and some of your thoughts on what we're talking about on Mornings today.
This is Mornings with Adam Shirley on ABC Radio Canberra.